going to try that again. I feel like we have the post-lunch fatigue. Good afternoon, everybody.
Good afternoon.
Thank you so much. It is an absolute pleasure to be here. I want to thank Dr. Christensen and the rest of the members of the Congressional Black Caucus and the Foundation for inviting me here to be able to speak on behalf of a program I'm very, very, very excited about, which is Text for Baby. And I just have to mention, if anybody knows anything about college football, to have somebody from Michigan speak right before somebody from Ohio State doesn't really work that well, but I'm going to try to do my best and ignore that. So I wanted to just start off, and before I speak, you heard before, my name is Dr. Wando Olayiwola. I'm the Chief Medical Officer of Community Health Center, Inc., which is a federally qualified health center in Connecticut, and I'm a family doctor. And before I talk to crowds, I usually like to just find out who is like me in the crowd so I can connect to you. So by show of hands, could I just have people tell me who in here is a mother? All right. Who in here knows a mother? Okay, all right, so we are all families. I'm going to get right into my talk. There's some things that have already been said by the Lieutenant Governor who spoke before me, and as well as Ms. Greenwright, so I don't want to be redundant. But I wanted to just make sure that you understand, and I don't think we can emphasize enough, the disparities in infant mortality in the United States. So I wanted to just do by show of hands, how many people think it's true that infant mortality rates are higher in the United States than they are in the country of Singapore? So you guys know your stuff. So you're absolutely right. About 3 times the rate in the United States is about 3 times as high as in the country of Singapore. And the United States has one of the highest infant mortality rates in any developed country in the world. And in the United States, I think you know this already, so I'm going to skip over this. We know that the rates of infant mortality in the United States are much higher among African American blacks than any other group. And this has been such a source of media attention, of research attention, and of complete medical confusion in terms of what do we do about this problem. So African Americans, blacks, are at the rates of infant mortality are about 2.5 times the rate of whites in this country, and almost 3 times the rates for Asians in this country. When you look at the preterm births, which means babies that are born prior to 37 weeks, which means prior to when many of the vital and critical organs have developed, I'm asking by show of hands, how many of you think that this is medically and societally costly? This is almost a free question, but it is absolutely expensive. So it's not just that it takes a toll on the communities in terms of the loss and the personal grief that comes with losing an infant or having a preterm delivery, but it's 10 times more costly to have a preterm infant than it is to have a term infant, just because of the medical care services, the attention to the mother, the lost productivity that results as a result of that. So when African American babies are 2.3 times as likely to die before their first birthdays than their white peers, or their mothers are less likely to actually begin to get prenatal care until the 3rd trimester, in some cases not at all. Or the fact that education does not protect at all against risk. Black women who have over 13 years of education are still 3 times as likely to have infant mortality than white mothers. So this is clearly discrimination in healthcare, and it's clearly one of the most shocking and inhumane parts of health disparities that we know of. I think in the words of Dr. Martin Luther King Jr., many of you connect, and this quote resonates with a lot of us, that this is just really shocking and it's really unacceptable. So you're probably wondering why I'm here. Dr. Christensen and Text for Baby did not ask me to come here and create a doom and gloom picture for all of you and make you all sad. I'm here to actually talk to you about some of the things that are really exciting and potentially innovative solution for patients in all of our communities. I'll start with the story about one of my patients, patient MC I take care of in Connecticut. She's a 26-year-old woman who has had 6 pregnancies and has 4 living children. She came to me during the 6th pregnancy. She's a single mother. She got pregnant in high school. She subsequently dropped out of high school. All of her kids at the time were less than 8 years old, and 2 of them were premature. She lost one in a late miscarriage, the 5th pregnancy, and so she was here now with another one, had been in a very vicious cycle of domestic violence, periods of homelessness, suffering from depression, anxiety, smoking, had very poor mothering skills and coping skills. And I'll just tell you that when I saw her, she had no laptop, she had no desktop, but she had a prepaid cell phone, and that becomes important later. And then my favorite patient in the world is this one, and this is me. So this is my story, and I'll tell you a little bit about how I ended up here and how I ended up connected to Text for Baby. So in the year of 2009, going to 2010, I had a pregnancy. It was my 2nd pregnancy. And I had every reason to have a good pregnancy, but during the course of that period, I had 10 hospitalizations and multiple other encounters with the healthcare system that was just extremely frustrating. So a lot of times when I would go to the hospital or to the doctor's office, I would not tell people that I was a doctor because I didn't want, partial treatment or anything. And so I would find it very difficult to get information. So nobody would tell me what this meant, what this diagnosis meant, what you need to do when you leave. They would just say, this is this black lady here, and you'll be fine. Go see your doctor when you're done. And I would just struggle with the fact that I wouldn't get information. And then I would sometimes have to pull my doctor card, which I don't like to do, but I did. I would say, I'm a doctor, talk to me like a doctor, and speak to me as if I know something. And what would happen in those situations that they still wouldn't tell me anything because they would say, oh, she's a doctor, so she knows. So you know what, you're fine, just, you know what to do. This is basically blank, this problem. So you can go and take care of that on your own. So in both settings, I was not really able to get adequate, timely health information. And I had every reason to have a good pregnancy, as I said before. I was very well educated. I went to Ohio State University, as I mentioned earlier. I went to Columbia to do my residency in family medicine. I went to Harvard to do a fellowship in minority health policy. I was in my mid-30s, married, non-smoker, healthy lifestyle, had all these different positives that should have meant she would have a good pregnancy with a very good outcome. But I had one strike against me, and that strike was that I was a black woman. And because of that, the scale was tipped very much against me. So in that period, I was working at Community Health Center Inc., where I am now the Chief Medical Officer. It is Connecticut's largest federally qualified health center, and I really appreciate the Lieutenant Governor's comments on the role of health centers in reducing disparities. We are a patient-centered medical home, as Ms. Wainwright talked about, and we serve patients in many, many communities throughout the state of Connecticut. We have about over 130,000 patients that do about 400,000 visits a year. Most of our patients, 90%, are at or below 200% of the federal poverty level. About 65% of them are racial and ethnic minorities, about 65% are women. We deliver about 700 babies a year in that setting, and most of our patients, nearly half of our patients, about 42%, are under the age of 19. So these women that I take care of in my practice as a family physician in our organization, and very similar to the communities that many of you come from, are in that low-income group, less than 200% of the federal poverty level. This is from a Kaiser Women's Health survey that was done a few years ago, and they were looking at women who needed medical care, but they delayed or forewent the medical care entirely for reasons, and looked at what those reasons were. And if you were in the low-income group, less than 200% federal poverty level, you were more likely to delay care because you didn't have insurance, you couldn't take time off of work, you had child care problems, or you had transportation problems. But we've long felt in healthcare that if we build these big, beautiful buildings, these great places, these illustrious and elaborate designs, that people will come and see us. But we've been finding more and more in our population there in Connecticut, and probably in many of your communities, that people are really looking for ways to connect without being in your office and listening to you. And just hearing about how much we use radio, there's so many other ways that people are getting information. We've also long felt, as physicians and as the healthcare community, that we are the most important and critical source of health information. That's where people access their healthcare information. But we found over time that we really are not, and that many people are looking at how do I get information without having to go into that office, and how can I connect without really being in person. But regardless of that, we still need to reach these women. And as I said, so even if they're going to forego their care because they cannot get access, they can't take time off of work, we have to be able to reach these women so that we can reduce these disparities in infant mortality and preterm birth that we talked about. So there have been a number of things that have been proposed as strategies to do this, and I'm not going to go into details about all those in the interest of time. But I want to talk about one that has been especially compelling, which is Text for Baby. Text for Baby is a free texting service that provides pregnant women and women, new mothers up to the first year of the infant's life with free, timed health information that really enables them to give their babies the best start in life. It's an educational program of the National Healthy Mothers, Healthy Baby Coalition. The founding sponsor has been Johnson & Johnson. And the text messages go to over 400,000 moms in English and Spanish, so it's the largest mobile health initiative to date. I signed up for Text for Baby during that pregnancy that I told you about when they first launched. I actually heard about it because they were asking our organization to be a referral site for women who were pregnant in the central part of Connecticut. So I decided to sign up as a user and was absolutely amazed. I would get, by just texting my date of birth and my zip code, I got free tips 3 times a week all throughout the course of the pregnancy. There was information on how to enroll in Medicaid and CHIP, how to find a healthcare provider, what are urgent alerts you should be aware of, how to be aware of your appointments, and feedback on a number of different things. So it really became the most critical engine of health information that I could get during that pregnancy when nobody would tell me anything. And just so you're aware, the content development process is highly elaborate, highly rigorous. There is a very detailed literature review, a lot of content review, expert review. It's tested, it's revised, and numerous healthcare bodies and institutions provide that input and that guidance during the process. So it's highly sound, and for those of you who are in the medical community, you will feel very confident in the messages. And it addresses all those major domains of solutions to the infant mortality and preterm birth disparities that we've seen in the African American population, because it covers the different topics that I didn't go into detail on. Text for Baby has more than 820 outreach partners, including health plans, state and local Medicaid agencies, health organizations, hospital networks, media, federal agencies. So they've really done an excellent job of making sure that this is everybody's business. And it's been a very exciting example of a public-private partnership through numerous organizations, including CTIA, VOXIVA, the Department of Health and Human Services, and many others. So I guess you're wondering, does it work? And does it matter? And has there been any impact from this program? And there has the University of California at San Diego and the National Latino Research Center has shown that women are finding that it helps them remember their appointments. It gives them warning signs that they don't know of. It helps them talk to their doctor about things that they've read on Text for Baby. So really it is facilitating interaction and increasing the patient empowerment. My patient that I talked about earlier used Text for Baby and went on to have a successful pregnancy, did not deliver a premature child, and got a lot of messages that were relevant to her pregnancy. Our patients across the state, 700 mothers that we deliver every year, love Text for Baby. They think it helps them ask things that they would never have asked or know things that they would have never have known. So I'm really just asking you, in my last few slides, will just say, I'm hoping that you will be able to bring this information to your communities, show pregnant women, tell moms about it, let them know that it's free, talk to them about it in your social circles and the places that you go and the places where women can be. Let them know that the service is free to them, that the content is good content because it comes from trustworthy sources and it's rigorously reviewed, and that they'll get the messages all the way until the baby turns 1. The number of provisions in the health reform bill, looks like I don't have time to go through those, that really will enable things like Text for Baby to thrive, and I will just hope you maybe can get the slides later and you can talk about later. And I will just ask, for all of you here in the crowd, the caucus itself, the foundation, to really join us in this effort, because you've really been influential in your communities in standing up for things that just don't make sense. So when people are discriminated against in the voting booths, you stand up. When people are having trouble getting high quality education for their children because of the color of their skin, you have all stood up. Looking at places where dignity has not been central to the attitudes of people that deliver care or take care of communities, you've really stood up. So I'm asking you to do the same thing that you've always done and stand up. And then finally, this is truly my last slide. I just wanted to, I know you're all wondering what happened to that pregnancy that I told you about, and this is what happened. So I was, luckily, by the grace of God, able to deliver that little girl there in the picture that looks happy to take the picture. She was born, only truly by the grace of God, and I made it through that pregnancy. But I was so happy to be able to get that information and add my little girl Nisi, named after Jehovah Nisi, to her older brother Darius, and very, very happy for the information that I got from Text for Baby at a time when no one else would talk to me. So I thank you very much, and I appreciate the time.
Thank you, Doctor, and thank you, Daryl, for moderating this for us. We appreciate it. And I want to thank the next awardee for her patience as we have gone in and out of the award ceremony. But the last award, the 2012 CBC Health Brain Trust Leadership and Advocacy Award, is going to a young woman who is a great friend and resource to the Congressional Black Caucus's Health Brain Trust, and of course to my staff and myself. Her name is Kimberly Bassett. She's the Executive Director of the Wireless Foundation. And despite her infectious laugh, her humility, and her tendency to shine the light on everyone else, Ms. Bassett played a pivotal role in the launch of the unprecedented public-private partnership that you just heard about, Text for Baby. It's a free mobile health service, as you heard, for expectant mothers from all racial, ethnic, age, economic, socioeconomic, and geographic. And geographic because it's in the Virgin Islands. We're very glad that it's there. Ms. Bassett, would you join me? We are thrilled. And yours didn't come apart. Oh, great. We're thrilled to honor you today, not only for your thoughtful foresight and innovative thinking about how to use wireless technology
good afternoon. On behalf of the 800 partners and more than 4,000 moms across the country, I'd just like to thank Congresswoman Christensen and the CBC Health Trust. This award is very, very special to me because of the people that we're reaching out. It's our people, and it's just a wonderful thing that you're honoring our program. I'd also like to thank our founding partners, Johnson & Johnson, who's been a wonderful partner. Also, National Healthy Mothers, Healthy Baby Coalition, who is also a founding partner who's done an exceptional job. And I'd also like to thank the wireless industry, CTIA and the Wireless Foundation, and all of our wireless providers who provided this service free and no charge to the mother. This is an example of a truly, truly amazing public-private partnership, and we're just so happy that we were able to provide this innovation to give really valuable information to mothers who need it most. And so thanks again, Congresswoman, and God bless you all.
Thank you.